6 months isn't a rule, it's a guideline. Hey everyone, I'm your super dentist and welcome back to my channel. We have all heard it since we were kids. We need to visit the dentist at least twice a year. But did you know this recommendation was not based on hard science? It actually started as a marketing slogan for the toothpaste company decades ago. While twice a year works for many people, the modern dentistry has moved away from one size fits all calendar. That's a fancy way of saying that your schedule depends on your specific biology, your lifestyle and your history. Today, let's figure out what your real number is. First, we have to understand why we go to a dentist. It's not just to check the holes in your tooth, it's actually to manage the bacteria. Every day, a sticky film called plaque forms on your teeth, and when we brush and floss, we usually disrupt it. But if we miss a spot, which we all do, then this plaque will interact with the minerals of the saliva and forms a hard structure called as calculus or tartar. Now here's the scientific reality. Once the plaque turns into a tartar, then you cannot brush it off. It cements itself onto the tooth, irritating the gums and leading to the gum inflammation. For some people, this hardening process becomes fast, and for others it is slow. That timeline dictates your schedule. So who needs to be on the chair more often? Usually every 3 to 4 months. You fall into high risk category if 1. You are a smoker or a vapor. Nicotine constricts the blood vessels. This hides the sign of the gum disease, that is bleeding of the gums, until it is advanced. Frequent visits are crucial to catch what eyes can't see. 2. You are a diabetic. There is a proven two-way street between the condition of your mouth and the diabetes. Uncontrolled gum diseases makes diabetes hard to manage, and the high blood sugar makes the gum disease worse. 3. You're pregnant. Hormones causing pregnancy gingivitis are real. Your gums may overreact to the plaque during this time, hence having that extra cleaning during the second trimester is recommended. 4. You have braces. The brackets and wires are basically foot traps. The risk of decalcification is high, hence professional cleaning regularly is often recommended. You have a history of periodontal disease. If you have ever had deep cleaning or a bone loss, then you're patient for life. The bacteria that causes gum infections repopulate very quickly, often in 90 days. Waiting for 6 months allows the disease to become active. Now, what if you have a perfect hygiene? You floss daily, you never smoke, and you never had a cavity. Probably for you, once in a year would be enough. However, most of the dentists will ask you to visit them once in 6 months. Why? Because a lot can change in a year. A small filling, if caught in an early stage, then a simple filling would suffice. But waiting for a year can turn a small cavity into a deeper cavity, leading to root canal. Prevention is cheap, fast and painless, whereas the repair is expensive, time consuming and uncomfortable. Visiting the dentist regularly is like buying an insurance against that expensive problems later. So don't just autopilot to 6 months. Ask your dentist or a dental hygienist this simple question: what is my risk level? Based on my risk level, how often do you suggest me to visit you? If they say 3 months, then trust them. They're not upselling you. They're trying to save your bones and gums. If they say 12 months, then congratulations, you are an oral hygiene rock star. Remember the golden rule of dental health. Dentistry works best before the pain begins. If you like this video, share it with your family and friends and help me spread the awareness. If you have any queries, drop it in the comments below. I would love to answer your questions. Do not forget to like and subscribe. Thank you for watching. See you in the next one.